Good afternoon, everybody, and thank you for joining us on the Managing Supplies and Medical Records webinar. My name is Debbie Roberts, and I will be facilitating today's session. So just to run through today's agenda then, I'm going to start off with user management in PCSE Online. So we're going to have a look at user administrators at the practice, what they are and what their responsibilities are, and how those user administrators issue roles in PCSE Online. I'm also going to look at the main contract change process and then just let you know where you can find some additional support and guidance with regards to user management in PCSE Online. We're then going to jump into managing supplies in PCSE Online. So I'll show you where to order supplies and how to order supplies, and then I'll show you how you can track orders and review previous orders that the practice has made. And then we're going to be looking at medical records in PCSE Online. So we'll talk about medical record tracking labels. We're going to have a look at GMS3 forms for temporary residents. We're going to touch on urgent medical record requests and missing and incomplete records. We're then going to talk about records that are being sent to home nations and when you need to print digitised records. And then we'll end with access to medical records. Okay, so we're going to start off the presentation by discussing user management in PCSE Online. Now, having the correct user set up at your practice ensures that certain tasks and work can be completed in PCSE Online. Now, in order to assign PCSE Online roles, you'll first need to ensure that your user administrators are set up at the practice. Now, user administrators are responsible for ensuring that other people at the practice have the right role assigned. Now, if you're a user administrator, but you don't have any other roles in PCSE Online, your only job is to assign roles to other people. If you are a user administrator and you want to be able to order supplies in PCSE Online, for example, you will need to assign yourself the additional role to be able to do that. But I'm going to go into a bit more detail about what each role does on the next slide, so don't worry if I've gone a bit fast there for you. At the practice, there are 3 different user administrators. Now, you've got your GPP, Practice User Administrator, and they're responsible for all the payments and pensions roles. You've got your main contact, and then you've got your PL Organisation User Administrator. So the PL Organisation User Administrator will be responsible for assigning the PL Practice Manager role. So if GPs join and leave the practice, those employment changes can be approved. However, for this presentation, we're going to be concentrating on the main contact because that's the user administrator that you're going to need to be able to assign the roles to be able to order supplies and manage the movement of medical records at the practice. With regards to user administrators, you can have 4 of each at the practice. However, you can only have the one main contact. So it's really, really important that the main contact that you've got assigned at your practice is current and relevant and still working at the practice. Otherwise, you're not going to have somebody that's able to assign the roles that you need to order supplies and manage the movement of medical records. Now, if you don't know who your user administrators are, or if you need to change your main contact, you can email PCSE, and the email address is just shown there on screen. It's pcse.portalenquiries@nhs.net. Okay, so I'm just going to go into a little bit more detail about which role does what. So I just wanted to show you this slide just to give you a bit more of a visual to help you understand it a little bit easier. So as you can see, we've got the 3 different areas. So we've got supplies and logistics, which would be your medical record movements and ordering supplies in PCSE Online, which is relevant to this webinar. So first off, you need to ensure that your main contact is up to date. And then it's the main contact's responsibility to make sure that those that are working on supplies or medical records have got these roles in PCSE Online. If you've only got the main contact role, you won't be able to order supplies. You will need to have the practice order entry clerk role in order to order supplies. And again, if you've only got the main contact role, you're not going to be able to manage the movement of records in PCSE Online. Now, how it can be a little bit confusing sometimes is that some people have understood it that if you're a user administrator, you can assign any roles, but that's not the case. So as you can see, it's been split out into 3 separate areas. So your supplies and logistics, performer list services, and then you've got GP pensions and payments. If you're watching this webinar and you're thinking, well, I've got the GPP practice user management admin role, that's great. However, you'll only be able to assign the roles that are relevant to GP payments and pensions. If you need to assign somebody the practice order entry clerk and you're the user administrator for the GPP practice user management, you're not going to be able to assign that role. It's the responsibility of the main contact. So again, if you know somebody needs a supplies role, get in contact with your main contact. They will then be able to go into PCSE Online and then assign the correct person the correct roles that they're going to need to be able to order supplies and things. Now, I'm just going to quickly show you, well, explain to you how you can update your main contact in PCSE Online. Now, a main contact cannot assign or create a new main contact role, so you will need to contact PCSE to do this. Now, it is a little bit different because with the other user administrators, they can assign another user administrator, but with the main contact, you do need to contact PCSE for us to manually change that at our side. Now, we just ask that if you do need to change your main contact in PCSE Online, that you call our contact centre if you're at the practice. If you are going to do that, you are going to need a colleague on hand to verify that change. You can use the contact us inquiry form to raise a case with the team. However, you'll just need to make sure that you can provide your organisation code, name, and email address, and the new main contact details. Okay, so like I say, it's been a little bit of a fast tour of user management in PCSE Online. If you do need more information, we've got a wealth of information that is available to support you in managing your users in PCSE Online. We've got videos on the PCSE YouTube channel, and we've got user guides as well that are available on the PCSE website. Anything that you need, please do let us know and we will try and support you where we can. Okay, so I'm now going to start discussing the supplies management in PCSE Online. Okay, so your NHS England supplies, including NHS stationery, pre-printed forms, needles, syringes, etc., all need to be ordered through PCSE Online. You can order and track your supplies online. You'll be able to even check the delivery times and review products that you've previously ordered. Now, you're probably already aware that all our orders are delivered by our national logistics firm called CitySprint, and deliveries will be made to your practice on the same day each week. And as I've previously discussed, if you are responsible for managing supplies at your practice, you are going to need the practice order entry clerk. And again, if you need that role to order supplies and you don't have it, you'll need to speak to your main contact at the practice. If you don't know who your main contact is, just contact PCSE and we'll be able to support you with that. Okay, so to order supplies, you'll need to be logged into PCSE Online. Supplies can't be ordered through the PCSE website. However, you will access your PCSE Online login through the PCSE website. Now, to sign into your PCSE Online account, if you just look at the top here where it says PCSE Online login, that's highlighted in green, you just simply select that, and then that will take you to the home page. And here will also indicate which roles you've got assigned to your PCSE Online account. So for this example here, you can see in the tabs, we've got the performer list tab and the records and supplies tab. Now, that would indicate that this user has got performer list roles in PCSE Online and records and supplies roles in PCSE Online. It may be that you don't have these roles, and that's fine, but if you need them, you'll need to speak to your main contact to assign those. Now, if you wanted a performer list role, you'd need to speak to the user administrator that's responsible for performer list services. If you don't have the records and supplies tab, again, it would indicate that you don't have the correct role in PCSE Online, and you will need that to continue. Okay, so once you have clicked into the records and supplies homepage, you'll need to log into your specific organisation by entering the practice name or practice code. And then from here, you can select your organisation from the drop-down menu, making sure that if you are ordering supplies and you're part of multiple organisations, that you are selecting the correct practice and organisation that you want to order supplies for. We are aware that some people work at various practices, so if you are responsible for ordering supplies, just make sure that when you are logging in, you're actually ordering supplies for the correct organisation. Okay, so once you're logged into the correct organisation, on the home screen, you'll notice that you have a records tab and a supplies tab. This section will also inform you when your next City Sprint delivery is due, which is just shown here. And then further down this page, you'll see that there's a PCSE notice board, and that's where we will go on and let you know if any products are out of stock or if you needed to get a replacement. We'll put the details of the product that's unavailable and out of stock, and we'll also provide some alternatives should you need them. Okay, so if you want to start ordering supplies then, you'll just simply select the Order Supplies tab that's highlighted in green, as you can see on screen at the moment. And once on the supplies homepage, you can either order supplies or you can track any orders or previous orders. And again, it will still show you when your next delivery is due. Okay, so if we select the Order Supplies tab, this will then display a list of products that are available for your practice to order. Now, you can either search through the list by clicking the arrows at the bottom of the screen, or you can use the search function to search for the desired products. You can either put keywords in there or you can use the codes if you know them. So if you wanted to search for something, it would just be in the box here where you can see I've just got my little highlighter, and then you'll be able to select a category if you wish, and then select search, and then that will bring up the products that you're searching for. Or like I said, you can move further down the screen and you've got the option just to click through page by page. Now, when you have added all your required products to your order, you can view your basket and then submit the order. We just advise where possible, when you're ordering more than one product, we just ask if you can try and include it within one transaction rather than ordering products individually. Okay, so when you add an item to your basket, this screen will confirm the product added and give you the option to view your basket if you'd like to at this point. Or you can close this menu and then continue adding products to your basket, just like you would with any normal online order. It's like if you was ordering from Amazon or something like that. However, for this demonstration, I'm going to show you what happens when you click Go to Basket. Okay, so as you can see, it shows the products within your basket, just as it would with any online shopping experience. And here you can add and remove products along with changing any quantities. It will display the name of who you're ordering on behalf, and then it will also tell you when your next delivery date is due as well, along with the cut-off order point. Now, to order your products, you can select the Submit on Behalf of button, which is just here, and you'll also see the expected delivery date. But just please be aware, if you are ordering any personalised products, such as prescription pads, they can sometimes take up to 3 weeks to arrive, and that's simply because we're using an external company to print those. Okay. Now, if you wish to review any previous orders made to your practice, then you can check the Track Orders tab, and this will display a list of orders made, including their current status. So again, you can see the Track Orders tab here is highlighted in green, and as it says, it gives you a description on what you can do there. So I'll track the progress of your orders. So once that's been clicked, here you've got the option to look at all the different areas, such as orders in progress, etc., which you can see at the top here, it's selected on the All tab. But if you wanted to filter through and have a look at specific orders, then you can do so. So you can select submitted orders, anything that's in progress, anything that's pending printing, and anything that's ready for dispatch. It will show you items that have been dispatched, things that have been part delivered, things that have been delivered, and orders that have been cancelled. But as you can see from the home page on the All section, it'll give you a list of everything. So you've got your order ID, and it will show you the practice that it's been delivered to or due to be delivered to. It'll give you the ordered date and the expected delivery. It'll give you the ordered type and the amount of items that you've ordered, and it will also provide a status as well. So as you can see just from the screenshot here that I've used as an example, we've got a delivered status and a product retrieved. So it'll just show you everything that you need on this page. Okay, so if you want to review any previous orders made to your practice, then you can also do that by selecting the Track Orders tab, which is just up here at the top that's highlighted in green. And this will display a list of orders that's been made with it, and it will also include their current status. So we'll just click into that one then. So as you can see, this displays a list of all the ordered products at your practice. And again, it displays kind of the same information as we just showed you on the last screen, just in a different way. So you've got your order number, the date it was ordered, you've got the product code, should you ever need that product code again if you want to go in and quickly order something. Give you the product name, so it'll give you a description of the product that you've ordered, and it will also show you the unit, so it will show you what kind of pack size that you're ordering, or you have previously ordered, sorry. It will show you the cost of the unit and the quantity, and again, that's just giving you the status because it's in a recently ordered products page. Now, if you want to have a look at that order in a bit more detail, you'll see that under the order ID, we've got the order number that's in blue. Now, with it being in blue, that means it's clickable, so you can click into that section. So I'll just quickly show you what that looks like once you click into that area. So as you can see, it shows you the order type. So you've got the delivery address on there. This is just for demonstration purposes, hence why I've had to take out the delivery address. But you've got things like the order date and the delivery date. And again, it shows you the status and whether it was an urgent order or not. Now, it'll also show you the list of products that were on that order. So here we've got an example of two. So there's two different products that have come through, and you can see that it's got a status of delivered. Now, in this section, you can print that off if you wish, but yeah, it's there if you need it. Now, that's all I wanted to run through with you with regards to supplies. We will have a look at medical record tracking labels in PCSE Online. So I just wanted to show you this slide again, just because it shows the roles that you need. So for managing any records in PCSE Online, you do need the practice records movement admin role. And again, if you don't have that role and you need it, get in contact with your main contact at the practice and they'll be able to assign that for you. Okay, so when a patient leaves your practice and joins a new practice, this is when a label will be generated and sent to your practice so you can forward the patient record to the new practice. Now, when you receive a label within your CitySprint delivery, you need to include that patient's record in a shipping bag, attach the label and provide that to CitySprint on your next collection day. Now, currently the system doesn't recognise if your practice has fully digitised its records. So if you do receive a transit label that you don't need, you can securely destroy that. Okay, so to manage your practice medical records in PCSE Online, again, you'll first need to log into your PCSE Online account and then select the Records and Supplies tab. Now, as you can see, you can select it at the top here that I've highlighted in green, or you can select it from the tile at the bottom. Now, as I've previously mentioned, if you log into PCSE Online and you don't see the Records and Supplies tab, say for example, this box doesn't exist and you've only got the Performer List tab there, that would indicate that you do not have the correct role in PCSE Online enabled to manage the records or supplies. So that's when you'll need to speak to your main contact to get the role. Okay, so when on the Records and Supplies homepage, to start managing your records, you'll need to select the Track Your Records tab, as highlighted in green. And again, just making sure that you are signed into the correct organisation before you start, which, as you can see, it's just up here on the right-hand side. Now, on the Records homepage, you'll see there's many different options available. So you've got your Records In tab, which shows the records that you're due to receive from another practice. And as you can see here on this example, this practice are waiting for 1,463. That's the amount of records that they've got outstanding from another practice. Now, we are also aware from the previous webinar that some practices do have a high volume in this area. So this is why we just wanted to touch on this. Within the records in section, if you have received the physical record successfully, you can go in manually and mark the records as received by clicking on the movement number and then selecting in storage at GP practice. We just wanted to let you know that the no paper record status is to advise GPs that there should be no paper records and to expect the records to be received GP to GP. Now, if the records are not received successfully GP to GP and there are no other movement in the records in section that shows the previous GP request in a label, then you'll need to contact PCSE. Now, if you do need to contact us because of this, we just ask you to raise a case via the Contact Us page on the PCSE website and then select the medical record movement inquiries and then just making sure that you provide the details for the patient and the movement numbers. Now, if you do have multiple patients that you need to inform us about, you can export this list and include it on an Excel spreadsheet from PCSE Online and send us that, which would be much more efficient rather than sending in single inquiry forms to us. Okay, so just going back to the records in section then. So if you wanted to view the records in this area, you'll select the View Records in tab. And here you will see a list of records you were due to receive at the practice. Now, this is a list of records that are due to be released from another practice as a patient has now joined your practice. When you receive the records in your citizen delivery, this area should automatically update. However, if it doesn't automatically update and remove the record from this list, like I've previously just mentioned, you can go in and manually accept the record. All you need to do is select the blue PCS number that you can see on the left. And again, you'll find with PCSE Online, if a number like that's in blue, it's clickable and it will open up the record in more detail. So say, for example, you wanted to confirm that you've received one of these records, you'll simply select the blue PCS number. And then what will happen is you'll see a message pop up as similar to what's shown on screen. I've had to put some different details on here just because to keep it without any personal details on there. So you will see that the patient name will appear. It will have the date of birth and the NHS number. We just request that you check that the details are correct before confirming that the records are stored at your practice. But if you're happy with the details that you can see and you're happy that you've got the records, in order to remove it from the records in queue, to simply select the in storage at GP practice, and that will then remove that record from your records in area. Okay, so we've got the records out tab, which shows the number of records you're due to release from a practice, from your practice, sorry. So that would mean that a patient has left your practice and has joined a new practice. So as you can see from this example, there are 978 outstanding records that are waiting to be released from this practice. Now, by selecting the View Records Out tab, this will show you a list of patient details that are due to have their records sent to the new practice. So if we just show you, for example, if we select the View Records Out tab, this will be the screen that you'll be presented with, and this will be a list of all the patients that you should be receiving a label for when they're registered at the new practice. However, if you're confident that you have forwarded the new record and it hasn't moved from this section to a delivered status, then you will need to raise a case with our online inquiry team and just provide the details and the patient numbers. And again, if you've got multiple patients on the list, that can be provided on an Excel spreadsheet. And then the medical records team will be able to go in and sort that out for you. Okay, however, there is sometimes that you may need to order a new or an additional label for the record movement, and I'll quickly show you how to do that now. So going back to the records homepage then, if you need to order an additional label or a new label, you can do that through the Manage Movements tab, which is again highlighted in green. So if you select the Request Movement, this will take you to the Request Movement homepage. Now, when requesting a new label, you need to enter the patient's NHS number, and what will happen is once that number's been inputted, that should auto-populate all the areas that are in grey. However, if the NHS number isn't recognised, then you will need to manually enter all these details. But please ensure that if you are doing that, that you make sure that all the details have been included. Now, if you submit it with just the NHS number, when you get the label, it will only include the NHS number of the patient, and it will also affect any future requests for this patient, meaning that any label that you order will only have the NHS number on there. So please do just take care when you are requesting a new label that you try and include as many details as possible. Okay, so once you have entered all the details, you just simply select submit, and then a label will be sent with your City Sprint delivery. Once you've received the label, you'll just return the record as normal within your next City Sprint delivery. Now, if you don't receive a label after around 3 weeks, that's when we advise you to contact PCSE using the PCSE contact form. Now, just be mindful as well about the 3 weeks if there are any bank holidays involved, for example, over Easter, because sometimes things can be delayed for those reasons. Okay, now when you are requesting a label and you're prompted with this message, you will need to contact PCSE for further support. Now, this message is basically saying that the most recent registration that PCSE has for this record is at your practice. So it's basically still stating that the patient is registered at your practice. However, if that's not the case, then you will need to contact us for further guidance on that. Okay, so when raising a case through the online inquiry form, we ask that you select the medical record movement inquiry form, so it's then sent directly to the team to investigate. Okay, so I'm going to see if Ian has any questions around the movement of medical records and tracking labels.
Thanks, Debbie. Nothing specifically so far on the tracking labels. We've had quite a lot of queries around GP to GP movement and what happens if that fails. So the team have been answering those queries, but essentially, yeah, if GP to GP fails, we do say that for the sending practice, for the records need to be printed out and sent. GP to GP isn't a PCSE system, so we have no control over success rate of that. I know it's an awful lot better than it did used to be, but yeah, essentially if it does fail, the only way the receiving practice is going to receive the patient records is the physical record being sent across. If you do have, as they mentioned, if you do have labels which have not been received yet, just contact us with the details of which ones you're waiting for. There may be reasons why they've not been received. It could be that the patient is registered at more than one practice, so they've gone to one practice on Monday, and then on Tuesday had a change of heart and they've gone and registered another practice. That essentially will prevent the translate label being printed at all, and our back office team will have to go through and essentially unblock that movement to allow the translate label to be printed. Sometimes there's reasons like that, which is why translate labels are delayed. But yeah, if there's anything you're waiting for, as they've mentioned, kind of 3 to 4 weeks and you're expecting it, just let us know. Easiest way is contacting us by email with the specific details, as that will go directly through to the back office team who'll be able to investigate and see if there's something which is blocking it in the first instance. We have had some queries, I think, from the last webinar around practices not getting transit labels every week. Sometimes that could just be a case of there aren't any for your practice that week. And it could be, again, as I mentioned, something that's stopping labels being printed. So just because you don't get a label pack every week, that's not an immediate cause for concern. We do have probably about 10% of practices we don't have a label pack for each week. So it's not out of the ordinary. But yeah, like I said, if you are expecting labels which you're not receiving, just raise the specific patient details through to us. There was another query just around main contacts and whether you can have more than one on a practice at a time. No, we do understand there are reasons where the main contact isn't available. It could be they're off sick, it could be they've gone on mat leave and aren't around for the next year. If you need to change your main contact, again, contact PCSE, and also all the advice for how to do that is on the PCSE website. Back to you, Debbie.
That's great, thank you, Ian. We are going to run through the completion of GMS3 forms for temporary residents. Okay, so GMS3 forms for temporary residents. So a patient who is away from home and temporarily resident in your practice for at least the next 24 hours and needs to see a doctor for medical advice or treatment is classed as a temporary resident. Now, for the first 24 hours, a patient can be treated as immediate and necessary, and a temporary registration, i.e. GMS3 form, can be in place for up to 3 months. Now, a GMS3 form should be completed with the patient's administrative details and the notes concerning their illness. Now, the form can be completed for patients who are offered telephone advice, immediate necessary treatment, contraceptive services, and minor operations and vaccinations, etc. Now, the form does not need a signature, but it does need to be filled out accurately, so all the information is readable. Now, once the patient's care is complete and they have returned home, the form should be returned to the patient's registered practice. Now, this process can be done through PCSE Online, and I just want to show you now how it's done. Okay, so on the records homepage, you will see the option highlighted in green for GMS3 forms, and this is where you can upload completed forms. You can also send forms to the patient's registered practice, along with downloading forms sent to your practice and ordering labels to send the GMS3 forms with your CitySprint collection if you choose to manually send them. Now, to upload forms and request labels, you simply select the GMS3 Forms tab, which is just the one at the top, because there is two in this area. So you've got the first option, which is to submit the forms, and then you've got the option to download as well. But for this example, we'll show you how to submit. Now, when on this page, you can simply upload an electronic copy for PCSE Online, but you'll just first need to make sure that you have entered all the details correctly on the form. You'll have to scan all the pages on the form and save each form as a separate PDF. We also ask that you save the file with the patient's full name. Now, once you have scanned your GMS3 form, you can either drag and drop the file into the highlighted box, which is just this one here. So if it's on your desktop, you should just be able to drag and drop it into that area. However, you can use the option of browsing the files on your computer. All you'll need to do is select Browse, find the folder where you've saved your document, and then upload it that way. Now, using PCSE Online is a much more efficient way to submit your GMS3 forms. When using PCSE Online for this functionality, you don't need any labels or shipping bags, and you won't need to give the physical forms to CitySprint. Once the form has been uploaded to PCSE Online, the receiving practice will receive an email to say a form has been received and it is ready to view in PCSE Online. And just to let you know that that email is sent to the main organisation email address that we have got on record for the practice. However, sometimes you may need to send your forms manually, and that's absolutely fine, but you will do that from this screen. So you can order your tracking labels here by adding the amount you require and selecting the request tracking labels. Once you do request these labels, you'll receive the labels within your CitySprint delivery. However, please be aware that when sending via a shipping bag, you can add more than one form in the bag. So if you have, say, 5 forms that you need to send at once, you can put them all into the same bag. And again, you'll just affix the label as you would when releasing a medical record, and then it will be sent with your next CitySprint collection. So if you need to order the labels, it's just in this section that's highlighted in green, and you'll see that you've got a minus and a plus section. So in the example that I've shown here, you've just got the one label. If you wanted one label for one bag, you could select request tracking label. However, if you need to order multiple, you'll just simply select the plus sign and then select request tracking labels. So you can also download your GMS3 forms from this section. You'll just simply select download GMS3 form, and this will display a list of all the forms sent to you to your practice that need to be included within your patient records. Now, with these records, you can either save them electronically or they can be printed and included with the paper record. And this area also shows you how many GMS3 forms you've received. So just looking at the example on screen then, if you want to download the forms, you'll select the blue tab. But as you can see, I don't know how big it is on your screen. However, it says the forms pending download here are 16. So that would indicate that 16 forms have been sent to your practice for your patients that are available to download. Okay, so when you have selected download GMS3 form, this is the screen you will see. Now here you can download the file and you have the option to archive once you have saved the record. And again, you can either save a digital copy or print it off to put with a paper record, or have a digital copy to upload to your clinical system. But it is quite self-explanatory. So as you can see, it will show all the relevant fields that you've got, and you can even search for these if you do have a lot of forms that have come through. You'll be able to search through NHS number, surname, forename, etc. And then on the right here, you'll see you've got the option to download the form, or you can archive that form if you've already dealt with it. Okay, just a quick one then. I don't suppose there's any questions, Ian, on GMS3 forms before we move on?
There's been one question around what the purpose of the GMS3 form is. Essentially, the form is for the patient's registered practice to understand any medical care that's been given whilst that patient hasn't been at the practice they're registered at. So PCSE back office team essentially repatriate those GMS3 forms onto the patient's registered practice. We have quite a lot of queries around the records out pages in terms of what some of that means, specifically around the no paper record part. So the no paper record created status is essentially for any patient who registered after January 2021. So people who've moved into the country or new births essentially. After that date, the Lloyd Georges were essentially no longer issued. There was a large cost of sending out just blank Lloyd George envelopes for those new patients. So that was a NHS England request to stop sending those out. GPs are required to maintain those records electronically and forward them on to the next GP using the GP to GP. So essentially, yeah, that no NPR created status is for patients that have registered with a new GP, but they haven't got a record. They do need to notify the next GP to expect the record by GP to GP. So if you do hold paper notes for one of those, or the GP to GP transfer has failed, you do need to send those and get them sent out using the transit labels. If you haven't got a transit label for one of those, you can go into the portal and request a label using the NHS numbers. We've also quite a few queries around either old NHS numbers or patients where you don't know what their NHS number is. Generally, if you've got specific queries on those ones, send the details into the online form on the PCSE website with specific details of whatever details you have got. PCSE have access to the patient demographic system, and we'll be able to identify using whatever details you have. So name, date of birth, previous registered practice, that kind of thing, and generally we'll be able to find out where the patient is. But yeah, you'll need to send the details through to our back office team to investigate further. I think that's the general theme at the moment. So back to you, Debbie. Thank you.
That's great, thanks, Ian. So moving on then, so we're going to touch on urgent medical record requests. Now, we do receive a lot of queries regarding urgent medical record requests. However, we just wanted to let you know that PCSE can't really control the timescales in which the record is received from the previous practice. Now, we just ask that if you are the practice that has been asked to move a record under the UMR request, you release the record as soon as possible so it doesn't affect patient care. Now, if you're not able to release the record, we ask as well that you can just send us an email and let us know that it might be taking a little bit longer. Now, if you have an urgent clinical need to access information in a medical record, PCSE can facilitate contact between you and a patient's previous GP to ensure the details needed get to the relevant clinician in good time. Now, when PCSE receive an urgent medical record request, we arrange for the patient's previous GP to either fax or email the information to the new practice, and then we will ask our previous practice to release a paper record in the next City Sprint collection. Now, but we just want to stress that this process will not ensure you receive the paper medical record any sooner. And if you do receive a request to release a record, that you do it as soon as possible so it doesn't affect patient care for the patient at the new practice. And again, if your practice doesn't have the record that we've requested, then please do just let us know via email as soon as possible that you're not able to locate the record. Okay, thank you. And if you need to request an urgent medical record request, then we just advise that you submit an urgent medical record inquiry using the online inquiry form that can be found on the PCSE website. And as you can see, I've just highlighted that in green for you so you know which form that you need to use if you need to request an urgent medical record. Once you do click into that, it will ask you to complete an online form, and then basically all you need to do is select begin and then you can complete the form. But just to make you aware, before you can complete this form, you must be a verified contact at the practice in order to submit. Now, once you click begin, you'll see it's an online form which is very simple to complete. The form is quick and easy to follow, and you will get the request straight to the team for processing. It will also validate the information as it's completed, ensuring that all necessary information is captured correctly and essentially minimising the risk of any rejections coming through to you. Now, when an urgent medical record has been successfully submitted, you will receive an email notification confirming that the request has been received. Okay, so just moving on then to medical records missing or complete. Now, in most instances, patient medical records are electronic and transfer between GPs via an electronic GP to GP file transfer upon successful registration at the practice. Now, PCSE move physical records directly from one GP to another, and we are responsible for the transfer of paper records only and not the content of those records. Now, PCSE don't add any information or remove any information from a paper record. Now, where a patient is not registered with a GP or is deceased, their records go into a physical central storage. So if a GP or GP practice notifies us of missing or incomplete records, we do have an established process that I'll run through with you now. Okay, so for missing records, a medical record can be classed as missing when a record cannot be found or is not available when required. A GP practice will contact PCSE to tell us that although the patient is registered and the GP to GP transfer has been successful, the patient's paper medical record has not been received. Now, once raised as a missing record, the PCSE team will conduct the following checks. So we'll check PCSE central storage just to confirm that we don't have those records on file. We'll check with NHS England and third-party storage facilities if the system indicates the record has been stored with an NHS third-party archivist. Examine record movements on the system and scan data from the courier to confirm CitySprint don't hold any part of the record within their network. And we'll contact all previous GPs that PCSE can identify to confirm that all the records have been released. Now, sometimes we locate multiple parts at different practices, and that would indicate that we would need to reconstruct the record. So we will reconstruct the record if the records cannot be located, and if the records are located, we'll facilitate the transfer of records to their GP. Now, we request the electronic records from the previous GP, but not all the previous GPs, as this would lead to a duplication of notes. Now, we send this to the current GP, and if the current GP advises those notes are incomplete, we will attempt to request further notes from other previous GPs. However, we may not be able to obtain notes from the previous GP. The previous GPs may have closed or have changed their electronic system and can no longer access the data. Now, in these instances, the current GPs are notified and advised to reconstruct the record based on the information that they do hold. If GPs don't respond to the missing records team, then this will be escalated to the ICB as per guidance from NHS England. Now, GPs are given 5 working days to respond, and then an additional 5 working days before it's escalated. Now, if you do receive a request from the PCSE missing records team, then please just respond as soon as possible, even if it is to advise that you can't find the record or you need a little bit more time. Now, when we are notified a record is located, we check the system to see if a label has been requested. If not, we will create the movement manually. And once the records have been collected, the current GP is notified that the records are found and in transit. Okay, so incomplete records. Now, an incomplete medical record means there is information missing from certain periods. Now, on occasion, a GP practice will contact PCSE stating that the record is incomplete and want to find the missing information. Now, when a GP practice contacts PCSE to say medical records is incomplete, we'll check the central storage that all records have been received and have been sent out to the current GP practice. and then we'll contact the last known data controller for the missing portion to forward onto the current GP practice. Now, if any records are found in central storage, then the record will be sent to the registered practice. If the portion of the incomplete record isn't found in central storage, PCSE will contact the last known GP practice for the missing notes, and if found, these will be forwarded to the current practice. Now, if the last known practice is closed, we will signpost the current practice to the relevant commissioner to ask them to assist in locating the missing portion of the notes. Now, if you do need to contact us with regards to an incomplete record, then we just ask that you use the PCSE Online inquiry form. Okay, so I'm now going to move on to guidance around Lloyd George's. So NHS England have now confirmed that if a patient's paper medical record has been successfully digitised, then you can destroy the Lloyd George, but you must do so securely. Now, if a patient is transferring to a home nation, so if they're moving to Ireland, Scotland or Wales, for example, a practice will still need to print out the record because the GP to GP file transfer won't work for those types of records. So a practice will need to print out the full medical record if the GP to GP transfer has failed, which it will if they're going to a home nation because it doesn't work for those. And if you are a digitised practice and are required to print a record for sending and no longer have the original Lloyd George, then you can simply just create a new one for that record that you do need to move. Now, this query came up quite a bit in the last webinar, and it kind of applies the same for any babies that have never had a Lloyd George. You can simply print the record and create a new Lloyd George in order to send that record manually. If you no longer have any Lloyd Georges and you need to order some additional, you can just do that through PCSE Online in the supplies area, as I've previously shown you. Now, again, in the last webinar, we did have people asking why the full record needs to be printed and why it can't be emailed over. And that's mainly due to the email files that can often be too big and then records are incomplete when they're being sent over. And sometimes we find that images aren't sent over correctly and things. We just need to make sure that the quality of the record and the full record is sent to the new receiving practice. And we just need to make sure that the new practice receives it in full at the best quality. Okay, so I'll now discuss printing digitised records. Okay, so when a patient moves from an English GP practice to a Scottish, Welsh or Northern Ireland GP practice, as I've previously mentioned, the GP to GP transfer will not work and the files cannot be sent in digital formats. So basically, GP to GP transfer won't work outside of England and vice versa. Now, labels will automatically be sent to your practice when a record needs to be sent to a home nation. Now, when sending patient records, the English GP will need to check the transit label to see the documents are leaving England and then print out the full paper record and use the citi-sprint delivery procedure. Now, when sending physical patient records to another GP practice, you've got to make sure that you print the records in full and ensure that the notes are clear for the receiving GP practice to be able to read them. Now, where a practice copies and pastes multiple pages onto one page, we often find that that results in the patient record being difficult for the receiving GP practice to read. And then sometimes in some instances, the original records can no longer be retrieved. So it's just really important that the quality of the records that you are sending in manually are in a good standard. So just make sure that they're all separately and they can be easily readable by the receiving practice. Now, if you need to identify a label that's for a home nation, you'll see that it's got the abbreviation just in this area. So you've got SCO for Scotland, which is also available here as well. And then you've got Wales and Northern Ireland. So once you are satisfied that you need to print and send a label, you can just print the full record and bag it as you would with any other record movement and send it within your next citi-sprint delivery. So there are some other occasions where a full patient medical record would need to be printed, and this will be if, for example, if a GP to GP electronic transfer fails, when the stop ID shows all those abbreviations I've just mentioned. So you've got Scotland, Wales, Northern Ireland, I think there's Isle of Wight on there, and Sometimes it will also say PCSE, which would indicate that it's going into PCSE central storage. And then you've also got ARC, which is going to archive. So when you do receive a label, it's just good practice to just check those areas to see if it does need to be printed and sent with your Citisprint delivery. Okay, so what to do if a GP to GP transfer fails? Now, GP to GP transfers can fail for many reasons, and in these scenarios, records do need to be printed in full. And the reason for that is that the patient may not be registered with a new practice, and the records need to be sent to PCSE central storage. Now, PCSE can't accept emails of records, we can't accept CDs or USBs, etc. We can't read them, so we can't accept them. So please don't send them. Please just send out the paper record. Now, practices using version 2.2a should integrate the received electronic health record promptly within 8 days. If not, the previous practice will automatically be notified at the end of day 8 that A, the record has not been integrated, and B, that the paper copy of the electronic record should be printed to send with a Lloyd George envelope to the new practice. Now, if you do need any further information about that, you'll just need to contact NHS Digital, and I've put the web address at the bottom of the slide there for you. Okay, so I just wanted to put a slide in about this because it was a question that we received either from the last webinar or a part of the invites of this one. There seemed to be a bit of a theme around it. Now, the question was about practicing receiving blank Lloyd Georges with a letter to state that the record has been digitised, and apparently on some occasions the record hasn't been saved, and when the receiving practice has contacted the practice that has sent the records, they've just been advised to contact PCSE, and they were wondering whether that was the correct course of action. So essentially no, because PCSE don't have access to digital records. We have no way of checking any records that are electronic. Now, if the previous practice details are known, we ask that you contact them. Otherwise, do contact PCSE with the details and we will try and get that rectified for you. If you are contacting PCSE, we ask that you send the patient details such as NHS number, name and date of birth so we can support you the best way we can. Okay, so just to stress on this one, because I know it is a very common issue with regards to the movement of medical records, we just ask that you do not send any CDs or USBs or emails of medical records. They can be damaged in transit or easily corrupted, which will then essentially could mean that we could lose the data on those files. And not every organisation can access CDs. And also USBs or CDs may not be safe to add to clinical systems. And sometimes we found that when documents are sent, they've got passwords on them, which means that the receiving practice can't access it. When they've tried to contact the leaving practice, the staff member that have created that password has sometimes left the practice, which then essentially leaves the note that nobody can access the notes. So all electronic health records must be printed and sent with a hard copy using your PCS tracking label. Okay, so unfortunately, if a GP to GP fails, then the only option is to print the record and forward it to the new practice. So, and PCSE aren't linked to any clinical systems. So again, we're not able to view those. Okay, so I appreciate I've just gone through quite a few slides there. So I'm going to hand you back over to Ian, if that's all right, just to highlight if there is anything that I've skipped through, anything that's coming through on the questions that you might need to clarify.
Thanks, Debbie. Quite a few queries around the use of the contact us form in terms of, do we need to send them all individually? No, definitely. If you've got multiple patients who've labels you haven't received, definitely send them all in one form. It's easier for you, it's easier for us. Got patients who haven't ever been registered with you, but you've got their record. That could be you've received from another practice incorrectly, you've done a clear out of your cupboards and find a load of records stuffed away which are no longer registered. And there's a page on PCSE Online under the records tab called movement request, where you can just go in there, put the patient details in, and that will create a transit label to be sent to you. Quite a few queries about digitised records in terms of what you need to do if you've been digitising records. We're actually in the middle of a project with NHS England where they're asking us to essentially stop sending transit labels to practices of digitise their records At the moment, labels get sent regardless of whether you've digitised your records or not, and both us and NHS England have identified it's a bit of a waste of transit labels being printed when there's no record to be sent. So we are working with NHS England to stop that happening. No action needed for anyone at the moment. We'll essentially be getting a list of practices to digitise their records from NHS England. We'll then be updating that into our system, which will essentially then stop those records needing to have a transit label printed. There will still be some caveats to that. So where patients are moving to home nations, so Scotland, Ireland, Wales, where they don't use GP, so we'll still need to print that out. Likewise, if the record is going into archive, again, the transit label will still need to be printed. So there's some caveats in there for why we would still need to be sending transit labels, even if you digitise your records. A few queries about kind of the details and content of what's on GMS1, GMS3s. That is actually outside of our remit, and we're not responsible for what is on those forms. So we've had a few queries from practices saying they're receiving GMS3 forms and it's just blank, it just says the patient's name, that's it. We don't have any control over what a previous practice puts on there. So if you are getting that, you need to raise it either with your clinical leads or with your ICBs. They'll effectively go via NHS England to get in contact with the previous practice, but that's outside of what PCSE will be responsible for. A few queries again around Lloyd George's and whether they can be securely destroyed once you've digitised your records. So if the records have been digitised and stored successfully, then yes, the paper records can be destroyed. However, if GP to GP has failed, then the digitised record will still need to be reprinted and put into a new Lloyd George. And as Debbie mentioned earlier, if you haven't got the blank Lloyd George, you can order those through the supplies page as well. I think that's kind of the gist of it. So Debbie, if I pass back to you to finish off, I think.
Thanks, Ian. That was really helpful. So, access to medical records then. I've just got a couple of slides on these. So, access to a deceased patient record. Now, if PCSE receive a request for access to a deceased patient's GP record from a member of the public, so for example, a family member or next of kin or a third party such as a solicitor, they will be referred to the last registered GP practice. Now, PCSE only process requests for the records of the deceased patients when submitted by the last registered GP practice. So, GP practices can apply for the records of deceased patients via the access to requests email address, which is just highlighted there on screen, or you can use our online form, which is on the PCSE website. So, PCSE only administer requests for deceased individuals whose last registered GP practice is now closed. So PCSE can only provide a complete copy of records held in storage for the patient. So the Access to Health Records Act 1990 states that the medical records should be reviewed and, if necessary, redacted by the most appropriate health professional before released. Now, in most cases, the appropriate healthcare professional is the most recent GP. Healthcare responsible professional is responsible for deciding whether access should be allowed, which records are appropriate for release, and if any redaction is required. Okay, so access to living patient GP records then. So if PCSE receive a record request for a living patient who are not currently registered with the GP practice, PCSE will process the request in line with the Data Protection Act 2018 regards to GDPR. These requests are known as subject access requests. Now, if PCSE receive a request from a patient who are currently registered with the GP practice, we'll refer the patient to their current practice. Now, if your practice hasn't received the record of a patient currently registered with your practice, you'll need to submit an urgent medical record request, also known as a UMR, from the PCSE website. And if your practice have received records but the contents are incomplete, you'll need to submit an incomplete record request from the PCSE website. Now, we do sometimes receive requests where we do still have to direct the individuals to the last registered practice. And this is, for example, if the patient's registered, has got incomplete records held by PCSE and a GP, which is also known as awaiting records from the practice. And in cases when we have received a CD, as we are unable to get those records sent on a CD. Now, if you do need to make a subject access request, again, we just ask that you use the online form, as you can see on screen here, and that can be found on the PCSE website, visiting the Contact Us section. Okay, so just before we do make an end, I just wanted to run through where you can find additional support should you need it. Now, when on the PCSE website, you'll see that at the top, you've got an option that says services. When you select this button at the top, it will bring up a list of all the service lines that PCSE offer. If you scroll down the page, you'll see that there is an area specific for GP practices. I'll just quickly highlight that for you so you can see that. And when you click into that page, you'll see that there is areas for each specific service line that your practice would deal with. And then we have just recently updated this webpage to try and make it as useful as possible for you. So we've put helpful links that will take you straight to the frequently asked questions, another link that will take you to user guides. We've also got our website search assistant, which is helpful if you've got a quick question to ask us. And we've also put the link in there for the GP practice playlist, which is really useful because it's got lots of supporting videos that are specific for practices. Especially if you've got new staff starting, have a look on there because it can essentially help you with staff training. But I'd just like to say thank you for everybody for attending. We hope you found the session useful.